How long have Pelave and all therapy been around? Are they safe for the neck? I'm considering these treatments for mild loose skin, crepiness of the neck. However, I do not want to risk any subcutaneous fat loss, as it seems to be a complaint from some Real Self members. Are there any research studies that have proven these therapies do not cause fat loss? Are the therapies technique dependent?
Thank you for your question. You're asking how long has Altherapy and Pelave been around and the safety for the neck, and what you want to address is some crepiness and skin quality of the neck, but you are concerned that people have expressed that they lost fat from these treatments, and that you want to know whether or not it is technique dependent. Certainly, I can help you with this question. I'm a board-certified cosmetic surgeon practicing in Manhattan on Long Island for over 20 years. I have used a lot of technology in these 20 years. I own Pelave, and I certainly can give you some guidance as to the modalities, as well the technology, and some other alternative options. So to begin with, what we want to first define before you look at these modalities, because these modalities are as a general rule, the technologies are oversold, and the claims are disproportionate to what they can really deliver. The photos are questionable, and it's very, very difficult to have for a consumer to make a rational choice when there is so much aggressive messaging. A lot of these new devices show up on different talk shows and then become so hyped that when you go to meetings, professional meetings, there is they become so dominant in their messaging, and then before you know it, they become obsolete, and you wonder if they worked so well, why aren't people keep using them? So when you talk about crepiness or you talk about loose skin, you have to understand that there is a difference between skin redundancy, skin laxity, and skin quality. And as we get older, when we look at the quote crepiness of the skin, we assume there's laxity and it needs to be tightened. A lot of times people just pull on their neck and think, oh, I wish it would look like this. But we know from surgery that the part of the limitations of facelifting, neck lifting surgery is in the intrinsic elasticity of the skin. So along comes these thermal energy devices that claim that you can heat the skin and get the collagen to contract and tighten. To a degree, that is true, but there is a limit. Unfortunately, a lot of overuse of these thermal devices results in loss of fat. And this is one of the things that I have observed a lot. Patients are coming in looking for solutions for volume loss, because when you just think of a younger person. Is a young person tight? No. They have volume, they have glow, they have healthy skin. It is my conviction that the fat layer under the skin is not there just for padding, but also has a very functional contribution to skin quality. We have confirmed this to many levels because we have a solution for hair loss, where we inject this material under the skin of the scalp, and we're able to treat thinning hair. We're able to treat with platelet-rich plasma and extracellular matrix. And so we're able to improve the skin quality of the scalp and improve and provide a solution for hair loss. What we do in our practice is we actually use platelet-rich plasma instead of heating. And we do use Pelave, but we don't use it as a first line, especially in people who have very thin skin. We actually use platelet-rich plasma, which is derived from your own blood, and we'll inject it into the dermis, into the backbone of the skin, as well as under the skin, and we're able to improve skin quality. If you think about aging, you could think that you can understand that there is loss of collagen, there's loss of blood supply. What does platelet-rich plasma do? It stimulates collagen, stimulates blood supply at no risk to the fat. In fact, it makes the fat healthier. This has been shown on published studies in peer-reviewed journals showing the fat cells looking better after platelet-rich plasma treatment. So I think that I would avoid a thermal energy device because the frustration that patients and practitioners have, it leads people down a very dangerous path. They pay a lot to have a treatment with a thermal energy device. The treatment gets done. They don't like the results. So what does the practitioner do naturally? They go up on the energy. They heat even more aggressively. The patient feels it's hotter, it must be working better. But the skin can only tolerate so much heat, and invariably there is loss of fat. There is always conduction of heat. Even though the device manufacturers will claim the ability to really be specific, you're looking at structures that are very, very thin, and it's very easy for the heat to be transferred. And I feel that people are literally getting their skin cooked with these thermal energy devices. We use Pellevé, but we use it very conservatively and very specifically. We'll use it under the eyes for fine lines, for people with darker skin who aren't good candidates for laser. But when you are doing your research, understanding redundancy, laxity, and skin quality, then you'll also understand why these devices have a limit. People try to avoid facelift by going for different thermal energy devices, and simply does not work. It's just not enough. People who have a lot of volume loss will actually add volume. We'll do something called a Y lift, where we'll place the fillers at the structural level above the bone, below the muscle, and we'll actually create the effect of a facelift by adding volume. We'll improve skin texture with platelet-rich plasma. So instead of trying to cook the skin to get it tighter, remember, a younger person doesn't look tight. They look healthy. Think about healthy quality to your skin rather than just tightening the wrapping. So I hope that was helpful. I wish you the best of luck, and thank you for your question.